Hello, everyone. It's June the 19th, Juneteenth, and I'll talk about that in just a few minutes. But June the 19th, 2020, you know, we all know the last few months they've been terrible in lots of ways. Inconvenient, an economic crisis, and not only that, the health scare to all West Virginians has been legit, and we've lost 88 West Virginians. Very, very proudly today, I can tell you that we have not lost anyone since June the 12th. So that's real progress. I'll also tell you later on that we have set a new record in our cumulative percentage of positive tests. We're down now to 1.67%. It's amazing. And I'll get to that in just a little bit. This is week 8 of our West Virginia Strong, the Comeback reopening. Week 9 begins this coming Monday, June the 22nd. You'll see all the guidelines up there, you know, whether they be youth sports or outdoor equestrians, we will be allowing spectators. We absolutely want you to remember to stay at a distance, and we highly recommend that you wear a mask. Today, I am signing an executive order which officially allows week 9 reopenings to continue. It also formally allows high school graduation ceremonies. Same thing. Please just be smart, stay at a distance, absolutely follow all the guidelines that we have told you over and over and over, and I think we'll be okay. Now, today is really a special day, a commemoration of the end of slavery, a very, very, very special day in our nation. Juneteenth, you know, and today of all days is the day that we just happen to be off from the standpoint of tomorrow is our state's birthday. So I am signing a proclamation today. And right here is the proclamation that's been signed to declare Juneteenth, today, a day of recognition in this country and in this state, you know, that today was the day that all slavery was ended. So nevertheless, I have signed a proclamation on Juneteenth, or for Juneteenth. Now, tomorrow, our birthday in West Virginia, 157 years old. I just gave a little talk just a second ago about this and everything, and I just said just this. You know, I've lived here my whole life for all practical purposes. We moved to Tennessee when I was just like 3 years old for about a year. I've seen my family grow from absolutely where my grandparents didn't have indoor plumbing until living the American dream. I became your governor, and my wife became your first lady. A little girl that grew up in Prosperity, West Virginia, was involved in 4-H all the time. Actually was the 1976 quarter horse queen in West Virginia. And she was given that crown at our state fair. Our state fair just announced that their board of directors had voted to not go on with the fair. And I respect that and respect it in lots and lots and lots of ways. We just had a terrible outbreak at a church in West Virginia that was right in my hometown in Lewisburg. Absolutely, the state fair gathers together thousands and tens of thousands of people, and that exposure, the board decided was just too much at this time. And we all, even though we'll miss the fair in every way, we all still respect that. To be perfectly honest, I'm really concerned too, but I'm going to stay concerned every day no matter what. I am trying with all in me to tell West Virginians that they can get back as close as I can see fit to being able to live their normal life. But I caution you, and I caution you over and over and over. That's why we have outbreaks. That's why we run to the fires. Now, but I can say back to West Virginia's birthday, just this. What a place to come to. What a place to live. We all know that are here how pristine our air and how clear and wonderful our waters are and all the goodness that goes on in West Virginia. We know just how good our families are. We know that we're faith-based and we're low crime and we're loving, appreciative people of one another. Now, through this miracle of West Virginia that's happened here, the world has just seen what a safe and good place that West Virginia truly is. More people will come now because of you, West Virginians. You have done it, and I am so proud of you, and I want to celebrate this great, great birthday. I owe everything in my life to West Virginia. As my wife, Kathy, on and on and on. You know, West Virginia, what a place. What a place that abounds in all the goodness beyond belief. Incredible natural resources, incredible seasons, absolutely the place that is within a striking distance of 2/3 of the population of the country that abounds with you, West Virginia, with you, the great people, the craftsmen, the people that absolutely are the loving and the principles and the foundation of all we got and all we've ever had. We have become the diamond in the rough that everybody missed. And West Virginia, just keep on doing it. Happy birthday, West Virginia, in every way. Now, if I could go on and tell you just this, that so many other things are happening. I talked to you just a second about the state fair. Over and over, you know, there's things about our website in regard to our cities and counties. Well, I think we have now received 120 applications. There's probably a number in the neighborhood of 250 that we are looking for, and we've received 120. We have now pumped out of the door $11,072,813.64, and we surely can't pump the money out the door until you apply. Now, there's guidelines that we have to follow from the federal government, and we're getting these monies to our cities and counties just as fast as possible. I just had a conversation with a couple of people that just said just this. Not only have we been emailing and talking as people have called in, but now we're even calling the cities and the counties ourselves, asking them, come on now, what's going on? You got to apply. Why don't we have an application from you? And so we're going on and on and on trying to get those applications and get those applications in to where we can get the monies out the door. You know, I want to just say just this, you know, and I'm not going to get in a food fight, you know, going back and forth, but we constantly have these little political, you know, daggers trying to throw, you know, whether somebody's trying to throw a political dagger at you for, I don't know what the motivation is, but to tell you the honest truth, I'm not going to play that game. I'm going to just keep my head down and keep on doing exactly what we've been doing over and over and over. Now, I can tell you this, that on May the 14th, in regard to our health departments, on May the 14th, we had a celebration in D.C. by our congressional and our senatorial people that they passed a deal that would bring $57 million to West Virginia. And that $57 million would be coming for our local health departments. There's only one real problem, guys. The money hadn't gotten here yet. And so I've been screaming and hollering to our people over and over and over, where's the money? Where's the money? And the other flip side of it is just this. As we go through all the different stuff that is happening, you know, all across, you know, our state and our nation, here's the problem. And I can't say it any more bluntly, but oftentimes we pass legislation out of D.C., and there's lots of times, lots of people that are voting that don't read the legislation. You know, If we would have been able to just write checks to be able to backfill lost revenues, not pension funds or whatever like that. West Virginia doesn't need anything to do anything like that. But if we would have just had legislation where somebody would have read it and been able to interpret it and be able to do the things that need to be done, this would be really easy. Really, really, really easy. But when they pass laws and the laws come down here and they say follow these guidelines, and there's some mumbo jumbos that 18 lawyers can't figure it out, it takes a lot of time. So the long and the short of it is just this. We'll continue to mud through everything and get the dollars out the door as fast as we can get the dollars out the door. And as soon as we get that $57 million, believe me, we'll be taking care of our health departments. And even if we don't get to $57 million, we're going to continue in every way to make sure that our health departments are taken care of as quickly as they possibly can. Now, oftentimes I say counties and cities, and I'm trying to be inclusive of them as well in that. And so I want them to make sure that people understand that I am absolutely inclusive of the health departments because they've done an incredible job, incredible work and everything. And whether it be DHHR money or it be CARES money or federal government money, whatever it may be, we need to take care of our health departments because they've done an incredible job, and we're going to do so. Now, I want the counties and the cities to continue to apply, and I urge them in every way. Now we're having to call them and everything else and say, please apply. Come on, guys, come on. Let's just get everybody to apply. Now, I've got some other announcements now. I've just been told that there's breaking news. There's a second church in Greenbrier County with an outbreak. They just told me that, and that's bad. It's not good. I don't know any more detail on that. Maybe one of our health experts can, weigh in on that, but I don't have any more detail. Up until right then, we had six church outbreaks in 6 counties. Well, there's still 3, that are active and 3 that have been resolved. In Ohio County, there's 5 cases identified associated with the church. 2 cases have been hospitalized. In Greenbrier County, 104 in the congregation that were tested. 34 of them were positive and 3 are hospitalized. In Boone County, a total of 8 church members have been tested positive. And again, I just go back to the same old, and that is please, church is our most sacred ground. Absolutely, you have got to wear a mask. And absolutely, you have got to stay every other pew. And if people aren't doing it, for crying out loud, step up and say something. Step up and show your voice and say something. And absolutely, if you're a concerned person, elderly person and everything, and you're concerned about what's going on there, you can't go this week. Until it's straightened up, you just can't go. And make those decisions yourself. Please protect yourself. If you protect yourself, you protect others. And and it's not worth it. It's just not worth it to awaken to a situation, and lots of times we can't help it. We can't stop it. But it's not worth it to risk standing beside a hospital bed, watching a loved one, a friend, a family member that just is struggling to breathe. Now, this disease is a killer, and we all know it. In West Virginia, we are just a minuscule of what has happened where they've had really terrible, terrible outbreaks. Now, please, just be smart, West Virginia, and keep on doing what I know you've done and the miracle of West Virginia that you have shown the world just how good you really are. We're going to have free testing again tomorrow, June the 19th and 20th in Ohio, Putnam, and Summers County. Next week, we'll be in Boone, Lincoln, McDowell, Raleigh, and Wyoming counties. Next Friday and Saturday, we'll be on the 26th and 27th, we'll be in Cabell, Hancock, and Mingo counties. Again, all the stuff's right there on my website, right up on the screen. It's optional testing. It's for the minorities and it's for the most vulnerable people, but it's for all that are concerned. It's nothing. It takes 10 seconds and absolutely it's painless. Go get tested. The more we're tested, the more we know. The more we tested, the more we're going to be able to help. Absolutely get tested. So thank you so much in regard to that. I've got something to tell you again. I touched on it on Wednesday, but think about this. We got a lot of farmland in South Carolina, and we farmed an awful lot in South Carolina. My daughter went to Clemson University and played basketball for them, and then came on to Marshall. We have a lot of really close friends and close ties in South Carolina. South Carolina opened up and did their opening probably more aggressively than what we've done in lots of ways. And lo and behold, now they've got a big time problem going on. But it becomes our problem too, because so many people from West Virginia love to go to Myrtle Beach, and it's a great place to go and wonderful fun and just beautiful as it can be and everything. But now, we have multiple people coming back from Myrtle Beach that are testing positive. Now, if you opt to travel to Myrtle Beach, and I would think twice before I did that, West Virginia, right now, because they got a real problem going on there. But if you do that, what I would highly recommend you do is when you get back, be tested. Be tested. Halfway quarantine yourself and be tested. And maybe not halfway quarantine yourself, but if you opt to go to Myrtle Beach right now, or go anywhere from the standpoint of leaving our state, take the time to be tested. You may very well save a life, and that life may be your own or somebody very, very, very close to your family. I want to tell you that our summer feeding map, if we could put that up, Jordan, our summer feeding map with 670 sites continues. Absolutely, we want our people to be fed. And if you're struggling with figuring it out, just call 211 and somebody will answer the phone and they'll help you figure out what to do. I've just got a couple more things, and this one is a jail update. And like I said, our corrections people and our healthcare community and National Guard and all those that ran to this fire, what a job that they've done. There are now 10 active COVID-19 cases at 3 jails and 1 prison. Think of the spike we had, where we had 120 or whatever active cases and everything, and all the facilities now have been tested, and we have tested in excess, I think, of 10,000 inmates. And I don't know how many people that work there, but it's in the thousands, probably somewhere around 4,000. It was an amazing job by our people, and they ran to the fire, and it looks like, we hope and pray, that they shut this down. We have 2 jails and 1 prison that have completely recovered from the COVID-19 situation, and all of our enhanced testing is posted on our website, and like I said, in our prisons, and I don't know of any state, I'm sure there's probably one somewhere, but I don't know of any state that could say we have zero deaths in all of our jails and our prisons today. I remind everybody again about the census. I don't know how many times I'm going to have to remind you, but really and truly, we're still not getting counted, West Virginia, and we need some help. And so from the standpoint of those street leaders or community leaders, please step up and help us. We need some help to make sure everybody gets counted. I want to report to you on a Raleigh County nursing home that we had a little bit of a scare earlier, that we had someone test positive at a Raleigh County nursing home, and everybody was all up in arms running to the fire there, and we found out that was inaccurate. Their there's no one positive at the Raleigh County Nursing Home that we know of right now. Last thing I have is this, this goes back a ways. It goes back a ways to the Fairmont Regional Hospital. It goes back a ways, from the standpoint of, whether it was in the northern or the central or the southern part of the state, the situation with our regional hospitals. I have said over and over, our regional or rural hospitals are our backbone of our communities. They're big employers. They're absolutely essential. We don't want to get in a situation to where we're putting somebody in an ambulance with a heart attack and driving them an hour and a half or 2 hours trying to get them to a hospital. We have got to support our rural hospitals, and I, as a state and as your governor, am committed to do just that. Right here in Kanawha County, the Thomas Hospital, we felt like, they had gone into bankruptcy, I think, and we were losing them, and it looked like, oh no, what in the world is going to happen here? And it's hundreds. In fact, it's well in excess of 1,000 people. I think it's like 1,600 jobs, and so we just got word that the Thomas Hospital has a plan now, and they are coming out of bankruptcy. And this is going to save 1,600 jobs here. I congratulate them, and Dan Laufer and, all the great stuff that they're doing, at Thomas is really good. During this pandemic, they stepped up and made St. Francis Hospital a COVID-19 surge facility. In the event our hospitals were not able to handle the capacity, we provided them funding through FEMA to set up this special hospital to assist our hospital system and maintain its load. And we truly appreciate their partnership and are so happy for them and all their employees and the great West Virginians that rely on them for their top quality health care. We couldn't be more happier than to announce that. That's great stuff. And so that's what we want. And we need to remember, we need to continue to try to support and help our rural hospitals because they are struggling and they're having a tough go of it. Hopefully we're going to be able to channel some real live COVID money to them, and and that's going to help in lots of ways. So I think that's all I've got. I just want to double, triple check, and everything. But I think that's it. I'm out.
All right, thank you, Governor. Let's first today go to Dr. Kathy Slimp, our state health officer. Dr. Slimp, we're working on getting you unmuted there, so if you don't mind to start over.
Sure. Is that better?
That works.
Super. Thanks and good morning. Just to clarify about the Second Church in Greenbrier, what we have is actually not a new outbreak in that church. We have an exposure from the first church. So some of the congregation members from a second church were exposed to an individual who became ill from the first church. And so we have simply been making sure we've notified all of those individuals that might have been potentially exposed, and the church has been closed for the next couple of weeks of services, just in case anyone were to develop illness there, and then they're doing cleaning at the church. So this is a situation of an exposure there, and that's what we're doing in that situation. The second thing I wanted to touch base on is the Myrtle Beach travel issue. Because this really has been a significant issue that we've been seeing lots of cases pop up in about five counties so far. We're up to 25 to 30 cases so far. And it really is important to think about, first, where you travel and the precautions you want to take when you travel. And then if you do travel to an area out of state, to really take precautions when you come back. So monitor yourself for symptoms for the next 14 days. It's that 14-day time period that you're at most risk for developing disease and spreading it to others. So monitor yourself for illness in that 14 days. Stay home as much as you can. Really try to avoid going out in public places. And if you can limit your travel to just essential things such as work or school, then do so, because that way you protect others. The third area is there if you do have to go out, if you're at work, etc., to make sure you wear a face mask, absolutely, all the time, anytime you are out in public places. And notify your employer so everyone can take precautions in the work site. And then the fourth area with that is keeping your distance, making sure that you keep your distance with that so that you're not exposing others again. And then if it's possible, work-wise, work with your employer to telework. So those are just things that we want to make sure that when we come back from high-risk areas, we really are taking the precautions to not spread disease further in our communities. We're caring for our family members, we're caring for our coworkers and our community more broadly. So just those good reminders to monitor yourself when you get home and to take every precaution not to spread it further. Thanks.
Thank you, Dr. Slimp. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and it's nice to be with everybody. I want to reinforce a couple of things that have been said. Number one is that we know that across this country, COVID-19 is spreading. The U.S. is the highest 2-week total in new cases that we've seen so far. And as we've heard before, at least one state, Arizona, has activated its emergency rescue plans. Like other states, we are seeing more COVID activity as well. The good news is that our rate of positivity overall is not rose significantly, but we know that, for instance, as Dr. Slimp just talked about and the governor said before, we have concerns about people that are traveling to areas of higher activity of COVID and then coming back and introducing COVID, both through, by being sick to other communities here in West Virginia, and also worried about congregate settings that are community-based. And the most important one that we have determined and seen here in West Virginia and in the country is related to churches and services where people gather and sing and talk loudly sometimes. And singing, we know, is really important as a mechanism of transferring this virus, creating those droplets. And as we've said before, one church choir practice with one person who is infected led to the infection of 56 of 62 people that were there. And 2 days ago, a discovery of a church, a large church in Oregon State, where 236 people now have tested positive for COVID-19. So this is a significant issue for us and for other states. And really to reinforce what the governor said, that as we go forward, it is really so critical that we take good care of ourselves and we wear our masks. We know that if 80% of people wear masks, it's like having a new drug. It's like having a vaccine that can work because we know that we protect others from our droplets if we happen to be infected and don't know it yet. And also we get protected. So that's really important, as well as having physical distancing. And again, we recommend 6 feet and washing your hands and being careful. If you see a place that doesn't look like a place where people are wearing masks, or it doesn't look like a place where you feel safe because it's indoors, or a place that you have to sit close to people that you don't live with, then avoid those places. As Dr. Slimp said, if you travel and come back, if you choose to travel, we want you to be safe, but we also want you to protect other people. So the US today has about a quarter of the world's COVID-19 cases, which is about over 2 million cases. The world has seen over 8 million cases, but it has half of the deaths. So we are accounting now for around 120,000 of the deaths. And so ultimately, what we really want to make sure of is we want to make sure that we continue to do the right things so that we can continue to open safely. We protect the vulnerable people here in the state of West Virginia. And again, we serve as the beacon for other people to follow. So thank you so much.
All right, thank you, Dr. Marsh. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. A couple areas to highlight today. The sanitization mission at Huttonsville Prison will be completed today. In addition, National Guard logistics support personnel have distributed masks now to all 55 county school boards, as well as the state-funded college and a couple of private institutions. So they're available for school year coming up. In addition, National Guard technical experts provided support to Greystone Baptist Church, both with sanitization efforts as well as best practices for potential reopening in the future. At the governor's direction, we're prepared to provide that same support to other churches to make sure that those that do have services follow the best mitigation strategies possible to ensure limiting the spread of the virus. Two non-COVID related items today. At the governor's direction, the National Guard has engineer personnel supporting Fayette County Emergency Management today and over the next couple of days with debris removal from the flash floods of the last couple of days. And for just general knowledge, there was a West Virginia National Guard convoy today that had a vehicle accident. 2 members of the National Guard were injured, but not seriously. So we appreciate the immediate response of emergency management personnel who helped and fire rescue folks who helped with that response, as well as there was a aeromedical evacuation of 1 member of the Guard for precautionary measures, and we appreciate the support of all those personnel who helped us today. Thank you.
Thank you, General. Also, Secretary Bill Crouch from the West Virginia DHHR is joining us and is available for questions. Media members are joining us virtually today to practice good social distancing. The first questioner we have is Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. My question has to deal with what you're allowed to say. We have had notification of specific nursing homes, specific long-term care facilities, but we have not had really a lot of publicity on what specific churches until the Major General just made a mention of one there. Also, if I am aware of outbreaks that were related to Myrtle Beach from Preston County and Berkeley County. If you found out that they went to the same party in Myrtle Beach, would you be able to talk about that? What exact information are we able to get at this point?
It's Paul, is that correct? Paul, to be perfectly honest, you know, everybody I think is kind of dancing through the raindrops. Everybody is trying as hard as they possibly can to not, to not break any of the rules, whether it be HIPAA or break any of the rules in regard to confidentialities and be respectful to others and all that. But Dr. Slimp can probably answer this better than I, but it is a complicated issue of which, to be perfectly honest, I don't know that I've got a good answer to it either. But Dr. Slimp, if you could maybe talk to us just a second.
Sure. We always do try to protect confidentiality of both individuals and facilities unless there's a clear public need to know. And that actually follows public health laws and regulations around that. So we actually really work, and the most accurate information is at the local level. We really work with facilities, and we often find that the best way is to encourage the facility themselves to speak to it publicly. It often becomes known locally, and they can that way come forward, talk about what's happening, and really be very open about the situation. And that often works very, very well. So we tend to encourage that to happen more regularly. We do public health-wise, if there is a clear public need to know specific, we do that and we give that. And the things that we look at most commonly is we look across situations to say what are the risk factors and get that information out. So as we start to see cases related to Myrtle Beach, we saw several cases from several groups that were going separately. Then we really started to say this is a critical area that we know we're watching disease come back to West Virginia in. As we see churches across happening, our focus is always on those prevention measures. And so the important part is making sure that everyone who's been exposed is aware of that. And so if we had, for instance, with a church, if we were not able to contact all the folks that had been in that church at that service that we were concerned about, then we would be saying something publicly about it. So it's always based on the fact that you're trying to do as much prevention as you can. You also want to protect the organization you're working with in terms of helping. You want public health. You want people to be reporting to public health that we know that we will work with them collectively in effective ways. And so that's just a balance we strike. But the key thing there is there's always, if there's a public need to know, if you can't find folks, then we let people know.
All right, thank you, Paul. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, we're about 11 days now from the end of the fiscal year. We've been waiting on Congress to open up the federal stimulus to backfill budgets since April. Can you give us an update on where the fiscal 20 budget stands at this point?
I think I can, Phil. You know, we've been meeting for all practical purposes every day, but in the last meeting that I had with them, which was day before yesterday, where we are at this time in the month of June, we are running about 20, maybe 24, $25 million ahead on collections of revenue than we forecasted after we drastically reduced our projections because of the COVID deal. Now, with all that being said, you know, with the experts from the Revenue Department and everything that we're talking about, and with the dollars that we have, we feel absolutely dead level confident now that we're not going to need an extra dollar whatsoever. You know, we'll be cleaning all this up and everything probably about Thursday of next week. But with the dollars that we can go back and reimburse back to ourselves, you know, and the dollars that we already have available to us cash-wise, we're going to be able to get through this year, balance ourselves out and everything, and get through this year and be okay. Now, as far as starting next year, the goodness of starting next year is we moved basically $200 million. Now, some people have already paid, so this is deteriorated down from that a little bit, but we moved the April 15th filing deadline and everything from April 15th to July 15th. So on July 15th, we're going to have an influx of dollars come in on July 15th, and so that's going to get us off and moving in the right direction there. But there are several parts of the guidelines that we have right now that will enable us to move through this year and be beneficial for this year as well as next year through December the 31st. But we still are holding out hope that what is going to happen is there's going to be more additional dollars and more additional stimulus and more additional abilities to backfill revenue come. But right now, just like I've told you from day one, I've said from day one, we're not going to hit the wall. We're going to stay right on top of it. We have not hit the wall. Everybody's still working. All of our programs are still running, and we're not going to hit the wall. Everything's going to be just fine to get through June 30th, and then we'll start the new year. And I think, like I've said many, many times, I can't predict many things really well, but I'm a business guy, and I'm on top of the numbers, and I've said the numbers were going to be okay, and the numbers are okay.
All right, thank you, Phil. Next, we'll go to Evan Bevins with the Parkersburg News and Sentinel.
Thank you, Governor Justice. I was wondering, as we look at cases with outbreaks and increasing numbers, what will go into determining whether some of the restrictions need to be reinstated, and do you feel any pressure, from the public or elsewhere to avoid that?
Listen, I want it to be as scientific as we can possibly make it. That's what we've tried to do. We've tried to use math in the science of what we're doing. From the standpoint of a statewide cumulative number of positive versus the number of tests we've taken, we're setting records like you can't imagine. It's at 1.67%. We wanted to get below 3. It's at 1.67, and when it gets this low, it's hard to go down anymore. But at the same time, I want to just say just this. I'm concerned. I am absolutely concerned. I will stay concerned. I will stay concerned every single day until we get to a drug or a vaccine that stops it. Now, are we going to have to change? Are we going to have to pivot and do things differently? Absolutely we are. Absolutely. And if we can't stop one of these outbreaks or whatever it may be, and we've got to pivot and we've got to change, we've got to go to mandatory masks, whatever it takes, I'm going to do. And I'm going to pray to God above that what my decisions are, that I'm staying out ahead of it in order to protect you. To be able to give you the abilities to go on about your lives as best you possibly can is tremendously important. It's important from the standpoint of people having a job, people being able to pay the power bill, people absolutely being able to live their lives. I got it. But at the same time, that's why my prayers up 10 times a day to our Maker in every way are that some way, somehow, He'll give me the wisdom to push the right buttons early enough to protect you as best I possibly can. Will we have to change? Absolutely. Am I concerned? Absolutely. Are we going to stay on top of it with all of our medical experts and medical teams and everybody all across this country and world? Without question. And so we just got to take it day by day. That's all there is to it until we get that drug that stops it.
All right, thank you, Evan. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, where is the sweet spot? We have a cumulative number of 1.67. We have about 680 some active cases in West Virginia, which has spiked up a little bit from 600. Obviously, those numbers for West Virginia are not great, but compared nationally, they're fantastic. Then on the other hand, you have the state fair canceling. You have other fairs and festivals out there which have the green light, but still haven't decided what their fate is going to be. Is there a danger of a mixed message that's going out? On the one hand, we're doing really well. On the other hand, state fairs canceled, really concerned, church outbreaks. I mean, where is the middle, and how should West Virginians feel about how the state's doing today?
Well, Kenny, to answer your question, we've said it over and over and over, there is no playbook. There is no answer. Where's the middle? From the standpoint of what I've said 1,000 times, if you just look at the numbers of what West Virginia has done, it's a miracle beyond belief. That's all there is to it. A miracle from God above. The numbers are unbelievable. And West Virginians should be very, very, very proud of that. But West Virginians are smart, Kenny. They're plenty smart. And they understand that we've still got to be afraid. In the situation of our state fair, the wisdom of people that were there, all of a sudden, from what I was told, we voted, and we voted almost unanimously to go with the state fair. And then all of a sudden, boom, an outbreak at a church right there in Lewisburg. Well, I'm telling you, it just shocks the fire out of everybody. And so all of a sudden, people are rethinking what they're doing. And that's what I have to do nonstop. That's what Kenny Bass has to do nonstop. The numbers are the numbers. I tell people to be happy and proud of what they've been able to accomplish. But I tell people nonstop, wear your mask when you go outside. Protect yourself. Absolutely, this is not over. And on and on and on and on. Kenny, we haven't had a single death since June the 12th. And everything. If we don't watch, we're going to divide our people. Our people are absolutely all pulling the rope together. We have got to all know that you've got a governor that absolutely the very second that I see this thing turn and whiplash back against us, I will shut down whatever I have to shut down, period, right then. But you also have a governor that is logical and a governor that has some good sense in trying to tell you to go about your lives as best you can and absolutely take every safety precaution you possibly can. You've got medical experts. You've got a team that we've put together that is second to none, and they're doing great work. So all of us are trying as hard as we possibly can to find that sweet spot. But Kenny Bass doesn't know where that sweet spot is, and Jim Justice doesn't know absolutely where it is because there is no playbook. But all we can possibly do is do what we've done over and over and over. We should be really proud, but we should stay concerned and stay on our game to get to the end of this.
All right, thank you, Kenny. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. On the $1.25 billion, the legislature has the power of the purse, but they're not in session. When and how should they get involved with how that money is allocated? And also, you have consultants who are working with you on it. Were those consultants subject to competitive bid? Thank you.
As far as I know, from the standpoint of the competitive bid, yes. Now let me back up. I may have spoke too fast there and everything, but I don't think that's the case. So I was just wrong in what I said there, but I think that what we are able to do here is select help and select people to be able to help us through this process and everything. And I think in that regard, that's what we've done. So forgive me, I spoke too quick in regard to that. But from the standpoint of the Fed dollars being appropriated, the Congress gave, I guess, the governors the ability to distribute those dollars. And so, in an emergency situation, that's what happened, and that's what the governors are able to do. Now, Brad, listen to me on this, and I would say this to our legislature. I would say this to anybody and everybody. Surely it's difficult to argue what we have done thus far. We have tried with all in us to involve our legislature, involve anybody and everybody, keep everybody as up to date as we possibly can. You can't just run nonstop keeping everybody updated. Everybody's surely watching what we're doing here all the time and watching our briefings, and we're updating and on the phone with everybody under the sun. Now, with all that, here's the thing we don't want to get into. We don't want to get into everybody in the world grandstanding and say we ought to be doing this, we ought to be doing that, and everything else. And before you know it, we'll just have a complete mess on our hands. And but we are constantly talking with all of our legislatures, and absolutely we welcome any of their comments and everything, and we're going to continue to talk to them. So we're getting through this. We're getting through it as best we can. And to be perfectly honest, I'm really proud economically how we're going through it.
All right, thank you, Brad. Next, we'll go to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members. Governor, given some of the things you just said, it seems to me there's a common denominator here, and that's people gather in churches and we have outbreaks. People gather at Myrtle Beach and we have outbreaks. The state fair is canceled because by and large people gather in big groups at the state fair and there's concern about an outbreak. Given what I just said, are you going to rethink this thing about having youth sports with fans this coming Monday? I listened to Dr. Marsh talk about the dangers of singing. I would think yelling and cheering at a youth sports event is just as dangerous in terms of spread.
Mark, I don't know how to answer other than to tell you we're rethinking and thinking everything nonstop. Now, just think about this just for a second. Just think. If you're in a situation and every last one of us realizes that the simplest way to not have potentially any problem is everybody just lock themselves down at their home, then we probably won't have hardly any problems. Is that the best for us? Are we willing to do that? The bigger the crowds, the more the problems. The more the cheering, the more the situation where people in churches don't use the guidelines and everything, the more the problems. and then we run to the fire. We absolutely I've said over and over and over that we're going to continue to have rough seas, and we got to make a decision. Are we willing to try to live through the rough seas and have as much normalcy as we possibly can, or do we lock ourselves down at our houses? Well, I don't think West Virginians are willing to lock themselves down. And I don't think from the standpoint of the economics of the whole thing that we can stand to be locked down. And absolutely, I know our hospitals and our health experts are ready to take care of us if we have a problem. And I know how good our National Guard is and all of our first responders to run to the fire. And that's what we're going to do. Now, as far as the sports that we're referring to, they're outside. They're outside. All we ask people to do is social distance as best they possibly can, and we think we can do that. Do we absolutely know? Well, of course we don't absolutely know. The only thing we absolutely know is just this: that if you go in your bathroom and you sit there and you've got enough food and water to make it for another 6 months, you'll probably be okay. We probably know that you will probably be okay. But absolutely, if you're not willing to just go do that, which I think is the wrong thing to do, then we're going to have to take risk. Dr. Slimp said the other day, there's no way to be sure. There is only a way to manage the risk. That's what we're just trying to do, manage the risk. And so I hope that answers your questions. We surely want the ability for our kids to be able to do stuff outdoors and everything, and we're going to watch it as close as we possibly can, and if we have a problem, we may have to change.
All right, thank you, Mark. Next, we'll go to John Mark Shaver with WV News.
Good afternoon, Governor. My question is, has there been or will there be mass testing in mental health facilities and other state facilities across the state? And when state workers return to work, will they have access to testing?
Secretary Crouch, you've got to answer that, please.
Yes, Governor, thank you. We are testing in multiple counties right now. When the governor talks about running to the fire, when there are embers for that fire, we make arrangements quickly with the local health department to do what we're calling biopsy testing, to go into a county, set up testing lanes, and allow folks to test for free. In most instances. In addition to that, the local health departments are doing a great deal of testing. We partner with them when we can. So we are testing across the state of West Virginia wherever we see the need to test. One of the goals, and we're approaching 8% of the population being tested, which I haven't looked at that lately. I believe we're number 12th or 14th in the country in terms of the percentage of the population we're testing. The governor gave us that directive weeks and actually months ago, and that's what we've done. So state employees are certainly available and welcome to be tested as well. Dr. Slim talked about individuals traveling out of state. We have a lot of employees in government who are also looking at vacations, and many of those are probably looking at traveling to Myrtle Beach or other beaches. We would caution them to please be careful if they still feel the need to do that. If they can cancel, I'm recommending canceling. When they get back, we're working on guidelines right now specifically for state employees so that those individuals know what to do. We've got to keep folks safe. If that means self-quarantining at home, working from home a little longer, then that's what we want. So our goal is to keep people safe, and we're going to do that as best we can. So thank you for the question.
All right, thanks. Next, we'll go to Anthony Izaguirre with the AP.
Governor, is there a point in which you think you would require that folks wear masks as we keep seeing these outbreaks crop up?
Anthony, there's absolutely a point. I would welcome you, to just look back at the numbers. If since June the 12th you've not lost a person, lost 88 too many. but since June the 12th, you haven't lost anybody. And today you said another cumulative positive percentage number that was unbelievably good. If our health experts and if our numbers turn south on us, then absolutely we'll make wearing masks mandatory. I think as clear as it can possibly be when we do that, you're going to alienate a sector of people and everything, and all of a sudden, before you know it, you're going to have us semi-divided. We need to continue to help one another. You know, we have just twisted and pivoted, maybe even in the last few days, because we're seeing an outbreak in Florida, an outbreak in Arizona, an outbreak in South Carolina. We're seeing states with real issues. And we're seeing it at home in a situation in a church in Lewisburg or a church in, Ohio County, or an outbreak from the standpoint of people that went to Myrtle Beach. And we're seeing every day that this situation is still with us, aren't we? Now, if you step back and you said any state in the country, you can have these numbers right here. Well, they would say unequivocally, tomorrow, open everything. So we don't have a problem anywhere. Well, we're not doing that. We're not doing that. We're trying as best we possibly can to let you have your life back, and we're trying to watch it. Now, Anthony, you've got to have this level of trust that really and truly, if these numbers start showing us bad numbers, and they start showing us more evidence that we have to make it mandatory, I'll hate to do it, but we'll make it mandatory in a second if that be the case.
All right, thanks, Anthony. We have time for one more. We'll go to David Beard with the Dominion Post.
Hi, this is David Beard. This is a question that's been addressed before, but some elected officials came to me and said that there's still some clarity needed. What happened was some volunteer fire departments approached those officials and asked two things. One, they're not sure how to go about their fundraising. Can they do that? And how do they do that? And two, they've got payments on trucks and other equipment coming due. So they want to know if they can get hold of some of the CARES money that's going to be distributed. And how can they get hold of it? Thanks.
Well, David, let me just make a stab at it as best you can, but we have not stopped their fundraising. We've not stopped that in any way. What I would do if I were them, instead of surely having a congregation of people and auctioning off items and so on like that, they've got to use their imagination a little bit. They could do it online. They could do it on some virtual ability like we're doing right here, but we've not stopped their fundraising. And I would say as far as their abilities to get at possibly CARES dollars and everything, federal funding that we have, please call us. Just call us. Call us on the phone and let us discuss it and see if there's a way to fit their situation into a bottle to where they can qualify for dollars. I mean, that's what they need to do. They just need to call us and let our people try to guide them. It may very well be that the guidelines are prohibitive and we can't figure a way to do it. But if they don't call, we'll never find a way.
All right, thanks, Dave. Governor, I'll turn it back to you.
Well, I want to go back to Juneteenth, and I want to say one last thing about Juneteenth. How did Juneteenth really come about? And Juneteenth came about, a long time ago. We had President Lincoln, who declared all the slaves free in 1863 rather. Now, when he did that, then what happened? There were some states that just didn't go along and just didn't do it. And Texas was one of them. And so in 1865, there was a general that was led led 2,000 troops and went there into Galveston, Texas. And basically, at that point in time, he said, today is the day that we're going to comply. And they did. And it just so happened that that date was one day before our state's birthday, June the 19th. So today we make a proclamation of June the 19th as Juneteenth, and a day that absolutely recognized throughout all of our nation that that day, June the 19th, 1865, was the day that truly that commemorated that slavery was done with. It's really an incredibly important day in our history, and I felt like it was just worthy to walk you back through it and make sure that all of our viewers and listeners understood that today, Juneteenth, June the 19th, is a really important day in our state's, in our nation's history. My last thing, I just wrote down just these notes. I've already said it, but we see the numbers. Watch the TV. We see what's going on in South Carolina and Florida. We see bars. We see the beaches. We see people standing on top of one another. They don't have masks on and everything else. What can you expect? What can you expect? West Virginians, when I go out and I see you and everything, I see you for the most part, you've got masks on and you're trying to do anything and everything you possibly can to protect yourself. I see you doing good stuff, and I see you pitching great numbers over and over and over. I see what's going on in Florida and all kinds of places, and I tell you just this, that if you decide to go on a vacation and you're going to go to Myrtle Beach or wherever it may be, please be careful. Please think real hard about getting tested when you get home, and absolutely be safe in all ways. But if you would opt to go to one of our state parks or do something in this great place in West Virginia, we'd rather you do that. But all I can tell you is just keep on keeping on, doing the very, very best you can. We're going to continue to try to run the fire and protect you as best we possibly can. And know we may have to change. And if we have to change courses, we will. But nevertheless, I'm really proud of you, West Virginia, and I'm not going to back up on that. And we're going to be okay. Thank you.